Thank you again for changing the date.
Yes.
Sure. And it's kind of funny because I had to send it. I always have to send in a request to get the computer lab or to have computers in here. And I was looking back at an email because they always send me, yes, we've got it scheduled. So I thought, what time? I need to cancel that date, today. But I had actually scheduled it for tomorrow.
Oh, nice. So we're just.
But I had already requested to change it to tomorrow, so she sent me okay, we've got you scheduled in the computer lab. And then I looked back at my emails because I was going to tell her, okay, well, we'll go ahead and cancel today. And I looked and it was scheduled for tomorrow in here. And I thought, okay, well, it worked out. We're going over there. So anyway, yeah.
Nice.
Yeah, so that's good. I was gonna say, no, but she moved away from the door. What's the secret passcode? That's right, sir. I guess you guys don't like those potato chips. Those are like the only ones left. Okay. So in post-operative phase, what are we responsible for doing? What are some of our responsibilities post-op?
Cleaning up the sterile field.
Gathering instruments.
Yeah, so cleaning up, gathering instruments, making sure they're taken apart, things like that, right? Okay. That's
Disassembling the sterile field.
yeah. What's our relationship with the patient and the patient's family?
Therapeutic.
Yeah, therapeutic. So what would be a negative body language?
Arms tightly folded.
Yeah, folded arms.
That one's hard because I get cold a lot. So I do this a lot.
I know sometimes I do that and I think, oh, you guys probably thinking I'm being closed. And I think about that sometimes. I'm so close. Don't talk to me. So who do we work under the direction of?
The surgeon.
Nursing.
Nursing. Oh,
Director of nursing.
Yeah, so yeah, DON, the director of nursing. What's the acronym DRG?
Diagnostic related groups.
Yes, diagnostic related groups. What is our, what are you guys now members of?
ASD.
Yep. And there is a board of directors that's delegated from the House of Delegates. It's elected from the House of Delegates. So the people who are on that are elected. And when you guys go in March, and hopefully everybody will be able to go, they're gonna elect some new members. And once you guys become surgical technologists, if you want to be elected to any of those positions, you just let them know.
I noticed when you register on the website that it says like voting, it says associate.
Associate, so you do need to be, as far as what your membership is, an associate member?
Yeah, because it said on like voting status or something, it said associate.
Yeah.
So if you do the CEUs, however long you have to do it, and you're not like either an instructor or an actual like surgical technologist in the field, are you still a surgical technologist?
Yes.
You continue with the CEUs?
Yeah, as long as you want to remain certified, you always have to have CEUs. You always, after 4 years, you have to turn in your 60 CEUs. Yeah, and as for accreditation purposes, I always have to be certified.
Because like I knew CNA, you had to like work in actual like establishment like 20 hours or something like that for 3 years, or and that's how you kept yours. So.
That's how you keep them, yeah.
Okay.
Yeah. So, I mean, it's kind of similar like that. They figure by getting your continuing ed credits that you're kind of like staying in the field. So, if my accreditation comes here to visit for whatever reason, sometimes they'll come, let's see, if our pass rate isn't meeting the standards for so many years, after so many years, our accreditation will come. And they'll do a site visit and they'll want to look at student records and things like that. So they're, and that's called ARC, A-R-C, S-T-S-A. Okay, and that's Accreditation Review Committee or Council, okay? And so that's what they do. They review our stuff. But who do they report to?
KHEP?
Yes.
You report to what?
KHEP. So they report to KHEP. So that's where we get our accreditation. So if somebody has a infectious disease, who is the infection control nurse going to report that to? CDC. Give me an example of an intentional tort pertaining to a surgical patient.
Battery, defamation, false imprisonment, intention to inflict emotional distress.
Yep. So, and also like putting restraints on a patient, that is something you intend to do. So that's intentional. What's that term that describes pretrial discovery? Deposition. So what kind of a consent can a surgeon get or have if a patient is unable to sign for their consent? Implied consent. Under normal circumstances, the patient would normally sign it, right? What are the most common types of patient errors?
Oh, patient.
What are those called as far as, yes, as far as legal, unintentional torts? So what protects the public from unqualified healthcare providers? Credentials, yeah. So our certification, licensure, registration. So what do they call our professional behavior? Surgical techs? What is that? It's our conscience, remember?
Surgical conscience.
Surgical conscience. What legal doctrine is going to be most applicable if a patient is injured as a result of us being improperly trained?
Doctrine of corporate negligence.
Yeah, so doctrine of corporate negligence. They're saying that they should have made sure we were trained correctly. What is it that you give if you're giving permission for someone to touch you?
Consent.
Yes, consent. What part of your medical record has your pre-op, post-op diagnosis and
Intraoperative record.
yeah, intraoperative record? Yeah, what's that organization that focuses on patient and worker safety? You guys remember?
Yes.
Oh, let me go on. Worker safety, and it's a unique coalition with surgeons, OR nurses.
Council of Surgical and Perioperative Safety.
There you go, Council on Surgical and Perioperative Safety. Yeah, I didn't give you enough information, huh?
Yes.
So what kind of procedure gives a terminal patient symptom relief? Palliative, yes. What was Maslow's hierarchical structure?
Human progression.
Human progression. And what was Elizabeth Kubler-Ross known for?
The 5
5
stages of
stages
grief.
of grief.
After a person is dead, what organs can be donated?
Cornea.
Cornea, skin.
Yes. So bone, corneas, things like that. What religion believes in reincarnation?
Buddhism.
Buddhism, yes. Oh. Oh, okay. So it's a question about a procedure on an elderly patient that doesn't like the way they look. So what you guys, I don't know if you guys can remember the surgical procedure for that.
There's rhinoplasty and black.
Yeah, so rhinoplasty and blepharoplasty. So basically, facelift, yeah.
Rhinoplasty and what?
A blepharoplasty. Denial, rationalizations are what are the examples of?
Coping mechanism.
Yes, coping mechanisms. See, I told you guys were ready for this.
But we're not all answering as a group. No, just kidding.
It sounds like it. Shane, you answer all of these now.
You answer first.
Yeah, you answer first. She knows them. How long does a patient have to be considered cardiac death before they can remove
90 minutes.
yes, mechanical support? So yes, 90 minutes. What physiological response is missing from kids under the age of 6 months?
Shivering.
Shivering, yeah, they can't shiver. What's a common response of pediatric patients to injury? Results in gastric dilation,
Hyperventilation.
hyperventilation.
Can you reread that question, please?
What's a common response of a pediatric patient to injury, and it might result in gastric dilation? Hyperventilation.
Okay.
What organ is responsible for failure to produce insulin?
Pancreas.
What physiological measurement is rarely done on neonate patients because of risk of anatomical trauma?
Urethral
Yes, urethral catheterization. When they're doing, let's say, a C-section on a patient, they put that roll under their hip. What are they taking pressure off of?
Vena cava.
right? Aorta and abdominal aorta and vena cava. What level of a trauma center can meet all patient needs requiring 24-hour basis?
Level 1.
Level 1, yes. So what are some of the risks that we're going to be involved with an HIV patient that we could get HIV? Yep, so sharps, blood, any blood exposure, things like that. So
Biological hazards?
biological, yep. So talking to them in close proximity isn't something that's right. Kaposi sarcoma is sometimes seen in combination with what other disease?
AIDS.
Yeah. AIDS. What is the term golden hour?
It's our with just to treat trauma patients.
Yes, so for trauma victims. A patient with acquired immunodeficiency virus might have complications of multiple infections and be considered what? That might be considered, yes, opportunistic. A diagnosis that could cause social stigma over dramatization would be what? Can you think of?
People that have like AIDS or HIV.
Yeah, so patients with AIDS and HIV. What patient population presents to surgery with one or more comorbid conditions?
Geriatric.
Geriatric patients. What patient population is likely to have coexisting psychiatric illness?
Substance abuse patients.
Yep, substance abuse. So why would, excuse me, I need somebody else to talk for me. Why would sliding doors be preferred over swinging doors in the
Reduces
OR?
air turbulence.
Yes, because it reduces the air turbulence. Of course, you're never going to see them.
Just swinging doors.
Swinging, yeah. Because when you think about having sliding doors, you're going to have a track. You got to take beds over that. It'd just be a hassle. Yeah. What kind of positioning is used for Wilson frame?
Prone.
Prone, yeah. What do they call it when they are cleaning the OR after a procedure?
Turnover.
Turnover. So what are some of the things you need to do to keep yourself from being harmed from radiation exposure?
Thyroid shield and thyroid.
Shielding distance.
Yeah.
Right.
Shield.
Shielding distance and time. Yes. But yeah, you had it right. So in a, if possible, what kind of a zone do we want to create to keep us from getting sharp injuries?
Neutral.
zone.
A neutral zone, yep. What time of natural Immunoglobulins are responsible for type 1 serious allergic reactions. IgE, yes. You guys know this stuff. What distance from the impact site of a laser beam on tissue should the smoke evacuator be positioned?
Wouldn't that be like blocking your view? 1 centimeter is
1 centimeter.
That's like right in there.
Well, if you have it at an angle,
Yeah, so
yeah, because where they're cutting, you can be on the opposite side where it's not impeding their view, but you might not see it.
Right.
But you can hold it close.
Yeah, and like when they're using cautery, sometimes you're going to be like right beside them. Yeah, so you're not blocking their view, and if they don't like it, they will definitely let you know. Yeah, so that's good. What government agency mandates that ORs have biohazard exposure control plan?
OSHA.
OSHA, yeah. What's that head fixation device that attaches to the OR table?
The Mayfield brace and Mayfield.
Right, Mayfield. What steps what is the mnemonic you need to remember for surgical fire?
Pass.
Race.
Or race.
Race,
fastest for fire extinguishers.
right. What organization sets standards for electrical safety, use of medical devices?
AAMI.
Yes, so Amy.
Amy.
What's the acronym?
AAMI.
Or what's the full?
Oh, what is it? Did you get that?
Say it one more time.
Association for the Advancement of Medical Instrumentation.
What does AIM do again?
Amy?
AIM, yeah. Did they do it again?
It's question 50 on chapter 5 review.
And you're asking about Amy?
Yeah.
Okay, and what do? They set standards for electrical safety, also sterilization and use of medical devices. What high-level disinfectant, let me think here. Yeah, she already knows. What, yeah, high-level disinfectant, when items are immersed 20 to 30 minutes, is a sterilant, and then,
High level at 10 hours.
yeah. Guys, what chemical is a high-level disinfectant when items are immersed for 20 or 30 minutes? And a sterilant if it's immersed for 10 hours?
Cyanide.
Glutaraldehyde.
DKA.
Yeah.
I think that's chapter 5.
That's
Yeah, I
seven.
can't remember what
That's
chapter
review
it
chapter
was.
7, question number 2.
The physical or chemical process by which all living microorganisms, including spores, are killed is what?
Sterilization.
What's the term for inanimate objects that harbor microorganisms?
Fomites.
Fomites. Fomites. When we scrub, our skin is considered surgically clean. What do we need to soak our instruments in prior to taking them to CS, I guess, basically?
Sterile water.
Sterile water. When they manually clean surgical instruments, what kind of solution should be used?
Neutral pH.
Right, yes. So lukewarm water, detergent, and an enzymatic cleaner with a neutral pH. What's the risk of putting instruments of dissimilar metallic type in a washer sterilizer?
Electrolyte.
Yep, electrolytic conduction. What cleaning method relies on bubbles to implode?
Ultrasonic cleaner with cavitation.
Yes, ultrasonic cleaner. Why are items disinfected or sterilized in activated glutaraldehyde dried prior to submersion? Why are they dried?
To reduce
Because the moisture will eventually dilute the concentration to ineffective levels. What's the most important thing to verify prior to opening a sterile package?
Integrity of the package.
Right, integrity of the package. What should never be processed by immediate use flash sterilization? Yes, implantable devices. What would be the exposure time for an unwrapped instrument with lumens in a pre-vac air removal steam autoclave? 4 minutes. What kind of instrument alloy is lightweight, durable, and non-magnetizing? Titanium.
Or aluminum or stainless.
I don't know about stainless.
It's lightweight. It's non-magnetic.
Maybe it's not as durable.
But titanium's a great answer.
Yeah. So I guess the best one out of those. What scissors are often called suture scissors? Right, nails. Well, what instrument classification is tweezer-like?
Grasping and holding.
Yes, grasping and holding. What surgical drape is designed to expose a small anatomical structure like eyes or ears? Aperture. What dressing classification would a Minerva jacket and a spica cast fall under? Rigid. What drain works by passive action? Yep. What kind of syringe has no calibration? Yep, a bulb or an ear syringe. Basically, booger sucker. You're not measuring really anything. What instrument often has tungsten carbide inserts and cross-hatch serrations? Yeah, needle holders, needle drivers. What do they call the thread that is sewn into countable sponges for X-ray? Radiopaque.
I thought you said cannibal sponges.
Those cannibal sponges. So there's 3 lumens and a 3-way Foley. What are they for?
Irrigation.
So inflation, drainage, and irrigation.
Which one does an irrigation do?
So a Foley catheter is to drain urine or something like that. The other type is, it goes in arm. Yeah, this is different openings.
Yeah.
Filtration, drainage, and irrigation.
What kind of urinary drainage catheter requires an incision and anchoring to prevent it from being dislodged? Yes, good job, Rachel. Suprapubic.
Say that one more time.
A type of urinary drainage catheter that requires an incision and anchoring to prevent it from dislodging.
Okay.
What do Broviac and Hickman catheters do?
Monitor venous pressure.
Yes, monitor central and venous pressure. You guys, what kind of a self-retaining retractor doesn't have to attach to the OR table? Valve 4. Do you guys know what the book Walter, Greenberg, and Thompson, what those look like?
He showed us.
He kind of showed
Those are
something, but it
soft.
wasn't any of those. They were just similar.
Right. So I think I showed you guys Thompson, remember, with the big bars that come over? So those all attach to the bed because they're big retractors.
He showed us that. Was that the Thompson retractor yesterday?
Oh, yeah.
Acres?
Yeah.
He showed us one like a few weeks ago too. Like he threw it at the very end of class.
Yeah, I remember that.
The valve for.
Big one that
Yeah, we found it in the cabinet.
They were pretty big.
I think it was an O'Reilly or
O'Connor.
Oh, remember the one that I was showing you guys?
Oh, okay, that
you were
was the
looking?
one, yeah.
And I told you that one I always remember O because it's got the two. To me, it's O'Connor O'Sullivan.
Yes.
And then the other one that's like this, that's got the bladder blade and stuff.
Right.
That's the valve.
The valve 4 retractor.
What is the minimum number of suction systems required in the OR?
2.
Right. Anesthesia and us, surgeon. So why do, basically, why do they have radiopaque things and sponges and
Detecting
Reduce the
X-rays.
possibility of retains.
right? So to reduce the possibility of things being left in the patient, right? So what are some things regarding hair removal? What is the way that hair should be removed? Right, just as close to the surgery time as possible. Says they should use a razor. No, what does it say? Right, that's true. I know they talk about not really using a razor, but that's really what they use. Razors, and of course they do have some electrical things they use.
Didn't one doctor prefer to use like a razor blade instead of the penile doctor? But he said that they couldn't because they actually cut more.
Yeah,
The
wasn't he
electric
saying they've kind of done away with using those? Yeah. Yeah. They use electric ones a lot
I thought
I
he said
think
he
it's-
didn't like the electrical though.
because it doesn't cut as close. Yeah. Yeah, they don't like them. In some situations, they'll ask the patient to shave, depending on where the procedure is being performed. But, you know, they don't want things going back either, and hair grows back like overnight, so. Where do you put the safety belt on the patient in the supine position?
Right.
2 inches.
Two inches
above
above.
the knee.
Right,
Above or below?
2 inches proximal to the knees. So above. So what position is the patient going to be in if they require that they're being given anesthesia on their stretcher? Right. So before opening any supplies to be put on the sterile field, what has to be verified first? Right. Integrity of the pack again. How are you guys going to keep the Mayo stand from moving when you're putting the Mayo stand drape on it?
Put your foot on them.
Put your foot on it. Who's responsible for counts?
Surgical tech and the circulating nurse.
Yeah, so the circulator and the surgical tech. So Trendelenburg, reverse Trendelenburg, Fowler's, lithotomy, those are all basic. What is the basic position? Supine. Yeah. What's needed if the patient is in reverse Trendelenburg? Yes, so they don't fall off. Okay, so those are all the multiple choice. The matching is, and I was going to look up the chapters and didn't get a chance, but the ones that have resume, surgical assistant, job description, all those, there's 10 of those. And if you guys look back, it'll be the same 10. And then the legal ones, and there's 30 of those. What are these ones? Oh, Glasgow Coma Scale, PTSD, hypovolemic, all those ones, and there's 10 of those. Yeah, 10 of those. And the ones that have anesthesia card, suction outlet, fluoroscopy, those. 10 of those. The microbiology ones like prions, helminths, spores, viruses. And then the ones lateral recumbent, neutral zone, perfusion, all those. And then the rest is true and false. And there's 40 true and false, and I think you guys always do pretty well on true and false. No?
No. Those are the ones I'm most like.
Really? So a physician, so I'll go over true and false since you have a problem with them. So a physician who is contracted with a PPO or an HMO gets reimbursed based on a capitated rate of payment.
True.
So ARC STSA administers the national certification exam.
False.
False. Professionalism is a lifetime commitment.
True.
No, just only when you work. No, it's true.
I was like, what?
Yeah, you don't have to be professional at work. The AST's mission is enhancing the profession to ensure quality patient care.
True.
Right. We can talk about our daily experience as long as it's not in public.
False.
Captain of the ship doctrine says the surgeon is accountable for all actions in the OR.
False.
I thought that one was.
True.
like our own survey.
It's not, but it's saying all actions.
So it's false.
Yeah, so almost any time something says all or everything, then that means it's not true. Okay. So if we took a picture of a patient and posted it on the internet, we could be sued for invasion of privacy.
True.
General consent is obtained by patients admitted to the hospital, and it covers all routine services.
True.
True, yes. Living will and durable power of attorney are examples of advanced directives.
True.
So if we make an error in documenting in the patient's chart, we can erase them.
False.
False, yeah. In general, a surgical procedure represents a physical, psychological, social, and spiritual event.
True.
That's true. So in the OR, we should refer to the patient by their planned procedure.
False.
False. Cultural and religious values of patients can conflict with practice of modern medicine.
True.
The Title IX Omnibus Budget Reconciliation Act requires that hospitals establish a protocol for organ procurement or risk losing funding.
True.
That's true. Anointing of the sick is a practice of Muslim tradition and includes facing the patient towards the holy city of Mecca.
False.
False. That's
No anointing, but they do.
Anointing is Catholic.
Catholic. Okay. Pediatric patients require an enhanced team focused on the physiological needs in a more dramatic way.
True.
In many cases, for all age populations, pulse oximetry has replaced arterial blood gas.
True.
Wound healing in bariatric surgery patients is enhanced due to the increased vascularity of adipose tissue.
False.
False, yeah. Surgical site infections are the most common postoperative complication with patients with diabetes due to increased perfusion.
False.
Right, it's false. Patients with developmental delays may suffer cognitive disabilities.
True.
Locker rooms, administrative offices, those are examples of semi-restricted areas.
False.
False. Infectious blood saturated and dripping waste should be contained and discarded in red bags.
True.
Soiled sponges from the operative field are discarded in low to floor rolling line pick buckets.
True.
Polymethyl methacrylate is a gas used to sterilize heat-sensitive surgical instruments.
False.
False. What is it?
Bone cement.
Bone cement. The physical design of an OR is designed to control personnel, patient, and safety, supply traffic. True. In steam sterilization, thermal destruction of microbes is the result of denaturation and coagulation.
True.
Gravity displacement steam sterilizer cycles are much shorter than pre-vac cycles. False. Sterilization process monitors include mechanical, chemical, and biological methods. True. Internal chemical indicators should be placed in the center or most challenging portion of a tray. True. The relative humidity in a ETO sterilizer should be below 30%.
False.
False. So when you pass suture to the surgeon, the next step should be to pass straight Mayo.
False. Put it in this neutral zone.
True. Yeah, as soon
How
as
to
they
cut it.
suture, the next thing is you're going to be cutting suture or somebody else is going to be cutting suture. Syringes can be made of plastic, glass, metal, rubber. True. Penrose drains are active drains. That's right. False. One layer dressing is used on large draining wounds. False. Instruments should be handed to the surgeon in a functional manner.
True.
The purpose of a pre-op skin prep is to sterilize the patient's skin.
False.
False. The legs of a patient being placed in lithotomy should be raised and lowered slowly by 2 unsterile personnel. True. The proper sequence for performing intraoperative closing counts is the Mayo stand, back table, basin, kick bucket, and off the field. True. And of course, if included, patient first, patient, Mayo stand, back table, basins, kick bucket, off the field. Suction tubing are attached to sterile drapes with perforating towel clips.
False.
That's false, and I need to fix that again. If you did use perforating towel clips, what do you need to remember?
Not use it as a
Don't
candle.
prefer it.
That. So make sure you don't perforate the patient. You can't reposition them. You can take them off and use them again. They have to stay until you're done with the case. So there'll be times when you're going to use them, like on towels for the head,
How come you can't reposition?
because they go through non-sterile. The ability to anticipate the needs of the surgeon is one of the most important skills that we have to develop. Okay, see you guys now.
How many multiple choice questions are there?
You said 40.